Approximately 2 million Canadians have osteoporosis. It is more common in women over the age of 50, and in this population, 1 in 4 will develop osteoporosis.
Dr. Aliya Khan is a clinical professor of medicine at McMaster University and is a leading specialist on osteoporosis.
Osteoporosis can be diagnosed by the presence of a fracture with a simple fall. It can also be diagnosed by a bone density test. A bone density test helps us to understand how much mineral there is in the area of bone being measured.
Fortunately, Mary Lynn had a bone density test and was diagnosed before she had a fracture.
After being diagnosed with it, I knew that my bone density wasn't what it should be.
There are a number of risk factors for osteoporosis. Having a premature menopause before the age of 45 is an important risk factor, as is the presence of smoking, a prior fracture, and having a family member, especially a parent, with a hip fracture. Osteoporosis has a number of effects on an individual's life. It can affect quality of life by causing pain from spine fractures. It can cause spinal deformity, and it can also affect an individual's ability to breathe and live comfortably. Fractures cause death and disability, and osteoporosis is important to diagnose and treat as early as possible.
I've never had a broken bone, but I worry that could happen.
A recent survey has shown that women are more afraid of a hip fracture than of dying. A hip fracture is associated with loss of mobility and independence, and an individual who has a hip fracture may not be able to walk independently. They might require a walker or a wheelchair. The goal of therapy in osteoporosis is to prevent fractures and to allow people to live healthy lives.
I guess my fear that if I fell, I am weak in the hip because of it and in the spine, so it could be very damaging.
Bisphosphonates are very valuable treatment options for osteoporosis, and they continue to be effective therapies for this condition. Unfortunately, only 20% of people continue to take their medication 1 year later, and if we're not taking our medication, we will not be able to prevent fractures. We do have a new treatment for osteoporosis, and Prolia is now available in Canada.
Prolia is an effective treatment in the prevention of fractures of the spine, hip, and other key bones of the body. It is given to patients every 6 months as a simple shot by a doctor. The most common adverse events were back pain, joint pain, and high blood pressure. The most common serious adverse events were osteoarthritis, atrial fibrillation, and pneumonia.
I was glad that I was diagnosed earlier so that I could get onto a program rather than be in pain or falling and damaging something.
We have effective therapies for osteoporosis today, and I would like to ask all Canadians to speak to your doctor about your fracture risk and ask which therapy is best for you.
For more information about preventing and managing osteoporosis, speak to your doctor and visit healthandbone.ca.